Good afternoon, everyone. Today we are going to learn about obsessive compulsive disorder. Myself, Jamika Patel. First, we are going to see the history of obsessive compulsive disorder, what people were thinking about obsessive compulsive disorder in different centuries. So, in 14th and 15th century, people were thinking that they were possessed by the devil and treated by exorcism. In 17th century, people were thinking that they are cleansing their guilt. In 18th century, finally, they have considered medical issue like obsessive compulsive disorder. It is a medical issue. In 20th century, we'll be treating with behavioral techniques. So we have started treating with behavioral technique obsessive compulsive disorder. Let's see the definition, the meaning of obsessive compulsive disorder. It is an anxiety disorder. The person has recurring thoughts or images, which is called obsession, and or repetitive ritualistic types behaviors that the individual is unable to keep from doing, which is called compulsions. The person may try to support these thoughts or behavior but is unable to do so. The individual knows that the thoughts or behaviors are irrational but feels powerless to stop it. Definitions. So according to DSM-4, describes obsessive compulsive disorder as recurrent obsession or compulsion that are severe enough to be time consuming or to cause marked distress or significant impairment according to American Psychiatric Association. Obsession, it is defined as unwanted, intrusive, persistent ideas, thoughts, impulses, or images that cause marked distress. Compulsions, it denotes unwanted, repetitive behavior patterns or mental acts that are intended to reduce anxiety, not to provide pleasure or gratification. These are some images. Obsessive compulsive cycle. When you have obsession, it produces anxiety. So to reduce your anxiety, you start doing ritualistic things, which is compulsions. Then if you perform the things, then you will be having relief. Your anxiety will be reduced up to some extent that you have done, and you have cleared your problem. You have cleared your thoughts, which was producing anxiety. Now let's say epidemiology of obsessive compulsive disorder. It affects almost 3% of the world's population, starts anytime from preschool to adulthood, typically between 20 to 24 years of age. Many different forms of obsessive compulsive disorder. It differs from person to person. Causes of obsessive compulsive disorder is still unknown and better when diagnosed early. Classification of ICD-10. Obsessive compulsive disorder comes under neurotic, stress-related and somatoform disorder. So F42 is the number of obsessive compulsive disorder. F42.0 is predominantly obsessional thoughts or ruminations. For F42.1, predominantly compulsive acts, obsessional rituals. F42.2, mixed obsessional thoughts and acts. F42.8, other obsessive compulsive disorders. F42.9, obsessive compulsive disorder unspecified. So this was the classification of ICD-10. Now let's see etiological factors. So the first one is psychoanalytic theory, next is learning theory, and the third one is biological aspects. Under that, neuroanatomy, physiology and biochemical factors included. First, psychoanalytical theory. Obsessive compulsive patients have weak and underdeveloped ego. Regression to the pre-Oedipal and anal sadistic phase combined with use of specific ego defense mechanisms like isolation, undoing, displacement, reaction formation. It produces the clinical symptoms of obsession and compulsions. Let's see learning theory. It explains obsessive compulsive patients as a Conditioning response to traumatic event. Traumatic event produce anxiety and discomfort. Passive avoidance, staying away from the source. Active avoidance is staying with the source. Next, biological aspects. Neuroanatomy, neuroimaging techniques have shown abnormal metabolic rates in the basal ganglia and orbital frontal cortex of individuals with the disorder. Physiology, electrophysiological studies, sleep electroencephalogram studies, and neuroendocrine studies have suggested that there are commonalities between depressive disorders and obsessive compulsive disorders. And the last one is biochemical factors. The neurotransmitter serotonin as influential in the etiology of obsessive compulsive disorder. Next, signs and symptoms. First one is symptoms of obsession. Repeated thoughts about contamination. So in that you may lead to fear of shaking hands or touching objects. Next is repeated doubts. In that repeatedly wondering if you have locked the doors or not, turn off the appliances, whether gas is on or not. So you'll be having those kind of doubts. A need to have things in a certain order. You need everything in a certain order. Feels intense anxiety when things are not at one place. Thought of aggression, to hurt a loved one, and sexual imaginary. These are some pictures. Next is symptoms of compulsion. Washing and cleaning. You will be washing excessive hand washing, then house cleaning, then in counting, you will be counting number of times that something is done or not. In checking, you will be checking that one has done over and over. Requesting or demanding assurance from others. Then repeating actions is like you will be going in and going out, closing door again and again. You will be moving from the chair up and down. Then ordering, arranging and rearranging your clothes and other items. Here is the images of arranging the clothes. Next, clinical features. So, obsessional thoughts, obsessional ruminations, obsessional doubts, obsessional impulses, obsessional rituals, and obsessional slowness will be there. What will be the diagnosis? How we can find out that person is having obsessive compulsive disorder? So, the first one is physical examination, mental status examination, history collection will be there. Then, suggested by demonstration of ritualistic behavior that is irrational or excessive. MRI and CT scan shows that enlarged basal ganglia in some patients. PET scanning shows increased glucose metabolism in the part of basal ganglia. Next, we are going to see the treatment. Only completely curable in very rare cases. Most people have some symptoms. Relief with the treatment. Treatment choice depends on the problem and patient's preferences. Most common treatments are behavior therapy, cognitive therapy, and medications. So let's see what is cognitive behavior therapy. First, let's see what is cognitive. Cognitive is the thing like which is change in the way you think to deal with the fears. Behavior change the way they react to anxiety-provoking situations. Then exposure and response prevention. Slowly learning to tolerate anxiety associated with not performing rituals. Behavior. Psychotherapy. Talking with therapists to discover what caused the anxiety and how to deal with the symptoms. You can talk with your therapist about your problem in that. Systemic desensitization. Learning cognitive strategy to deal with anxiety. Then gradual exposure to fear object. Should be done when people are ready for it. All these things, systemic desensitization is you need to perform when people is ready for it, must be customized for each person's specific form of obsessive compulsive disorder and their needs. No side effects except increased anxiety with the exposure of fear. You will be having anxiety, increased in anxiety, often lasts about 12 weeks. Positive effects of cognitive behavior therapy last longer than those of medications. Obsessive compulsive disorder returns can be successfully treated again with the same therapy. Best treatment approach for most is cognitive behavior therapy combined with the medications. Next, we will be seeing medications. What will be the medication? So when person is having anxiety, we will be using anti-anxiety drugs, anxiolytics, benzodiazepines such as chloramdiazepine and diazepam, which gives a temporary relief from anxiety but not really effective on obsession and compulsions. Antidepressants, which reduce the depression. Because of common depression patients will be having who suffer with the OCD. Selective serotonin reuptake inhibitor alter the level of neurotransmitter serotonin in the brain, which helps brain cells to communicate with the one and another, prevents excessive serotonin from being pumped back into original neuron that releases it. They can bind the receptor site of nearby neurons and send chemical messages that can help regulate anxiety and obsessive compulsive thoughts. Most effective drug treatment helping about 60% of the patients. Example, Prozac, Zoloft, Lexapro and Paxil. Let's see nursing management, nursing assessment. Assessment should be focused on the collection of physical, psychological and social data. The nurse should be particularly aware of the impact of obsessions and compulsions on physical functioning, mood, self-esteem and normal coping ability. Nurse should also note the defense mechanism used, thought, content or process potential for suicide, ability to function and social support system. Nursing diagnosis, there will be ineffective role performance related to need to perform rituals as evidenced by inability to fulfill usually pattern of responsibility. So here I am summarizing my topic, obsessive compulsive disorder. We have seen definition, diagnostic criteria, etiology, clinical features, signs and symptoms, diagnostic evaluation, treatment and nursing management. And the conclusion, obsessive compulsive disorder is a complicated issue. Most cases are incurable. Best form of treatment is cognitive behavioral therapy in combination with the medications, which is anxiolytics and antidepressants. Most important thing that can be done to discover more about obsessive compulsive disorder and its treatment is to research in the brain. Thank you.